up by nearly $3,500 for a three-person household, and of those surveyed, 85% say it is more difficult to maintain their standard of living than it was 10 years ago.
When a family loses its income, one of the first things that's expendable is often health care, and that's where Volunteers in Medicine fills a crucial gap. Since 2008, hundreds of volunteers in the local medical community have been providing free health care to the Valley's homeless and the uninsured. The organization needs your help to continue. In October, the 4th annual Volunteers in Medicine Ball takes place at the Palazzo, and joining us with more on how you can help, and if you're a doctor, how you can volunteer, is the founder of Volunteers in Medicine, Dr. Florence Jamieson. Welcome, doctor. Thanks so much for being here.
Oh, thank you for having me.
Tell us a little bit about, you started this 4 years ago, you have one clinic, and now you're working toward a second clinic in downtown. Do you really need that to fill the need in the Valley?
We actually started about 2.5 years ago, but the organizing committee, the UNLV research feasibility study, all the legwork, the county, RFP, request for the building we're currently in at Paradise, took a couple of years before we opened our doors 2.5 years ago. And yes, there's a wait that goes on for months, and there's a great need. Paradise is one of 3 areas designated for the Volunteers in Medicine. The other 2 is Old Henderson, Water Street, and downtown Las Vegas, North Las Vegas, which has the highest concentration of people that are in great need of access to health care.
Now, you were saying that, so at the Paradise facility that you've opened, there is a long wait? Is that what you're saying?
Oh, yes, yeah. yes, because everybody from the city does come to that one clinic at this point.
How long of a wait generally?
Probably about 3 months, but if we get somebody who is urgent, we fast track them to the front. A gentleman who had worked a long time at the casino ended up in the hospital. Like many Nevadans, he was, like many people, had minimal savings. 2 out of 3 Nevadans have no savings, even though they may have been working for 20 or 30 years here. And then he could not get his COBRA. Many Nevadans can apply for Medicaid, but it's 6 to 18 months before it goes into effect if they are eligible. Nevada is 52 out of 52 U.S. states and territories. We come behind Guam in being eligible for assistance. So in other words, many states you have to be 100% poverty level to get medical assistance when you fall on hard times. In Nevada, you have to be 41% before you can qualify for Medicaid. So if you're chronically ill, like this gentleman who had a heart transplant, he was unable to get Medicaid, Social Security, or anything, and came to our threshold of our doors, never having to ask ever before in his life for help, as most of ours. And he was fast-tracked. We got him his medications through patient-assisted national pharmaceutical programs. Our specialist cardiologist saw him, as well as our internist. And over a 3-month period, his first 3 months in meds and his visits and specialists, we provided over $7,000 in free care. And he will share with you that he's alive today because of it.
So are you seeing people who are putting off maybe buying food and other necessities because they lack medical care, or putting off prescriptions and things like that?
What they do is they, you know, now, last year's U.S. poverty report said that 1 in 6 Nevadans live in poverty. That is, a family of 4 live on $22,000. They can barely do their rent and food. So what they're putting off is they can't even afford medical care. Medical care is astronomical. And many times somebody in that family is an asthmatic or diabetic. What we know now, unfortunately, is that people were laid off. We're still like #1 unemployment in the country. They've been without jobs for 1 or 2 years. And these people are often 45, 55, never had to ask for help, and these people in this age group are the not being rehired. And if we don't give them assistance, they literally can have a stroke, a diabetic coma. They end up often dying, putting in a body bag, saying it was natural death, and we call ourselves a civilized world.
How do doctors get involved with you?
Oh, they just have to go online to vmsn.org and fill out an application, or call me anytime, and we will get you an application, and I will give you a tour of our facility, and I will explain. We're primary care. We specialize in chronic illnesses, diabetes, asthma, hypertension, heart disease.
I don't want to interrupt. Do you expect the Affordable Care Act, the provisions as they come online, to lighten your load at all?
Well, they will lighten our load, but like every great civilization since recorded history, paperwork, red tape will still always leave an element of our population who is at greatest need that we need to care for, and the Volunteers of Medicine will be there for them.
Okay.
We are out of time. That'll be the last word. Appreciate your time today.
Thank you for having me.
Our pleasure. Thank you.